Now look at this. It's a Cambridge invention that will save lives in the future, and it has reached a landmark moment this week. 1,000 patients have now tried out the Cytosponge in a trial all over the country. It checks your esophagus or food pipe for cells that could become cancerous. But critically, it's cheaper, less intrusive and quicker than the current test, and you can do it at your GP surgery. Here's our science correspondent, Richard Westcott.
It looks so simple, but this tiny pill on a string is a potential lifesaver.
And it's coming, coming, and we have it out. Well done.
Tony Richards survived his cancer. Now he's volunteered to test the Cytosponge. It's a new device to spot the early signs of esophageal cancer when it can still be cured.
You get the feeling that your esophagus is being cleaned with a little bit of a brush, but a gentle brush. I just want to make sure that other people can have the chance to be diagnosed early, because that way we will get the recovery rate from esophageal cancer right down.
The idea behind this clever little invention is quite simple. You've basically got a sponge inside a capsule, and that is fed into the patient's stomach.
Over the course of about 5 minutes, this happens.
Once the capsule dissolves, you can pull the sponge back out up the patient's food pipe, where it gathers around 1 million cells. You can then test for signs of cancer.
You can see some of those cells here. They're the white bits gently floating around. Samples are taken to a Cambridge lab to be shaken up, poured out, and then delicately put onto wafer-thin layers of wax until they're ready to be checked under the microscope.
Richard, we're looking for a strip of cells that you can see here, which have rounded dark circles. Sometimes the circles are clear, and these are indicative of the precancerous condition, Barrett's esophagus.
Maria's part of the team who've spent 10 years developing both the sponge to gather the cells and the special way of marking out the ones that might turn bad.
So this test could be the difference between getting cancer and not getting cancer. Only takes a few minutes. It's much easier than having a tube passed down your throat. It's much cheaper than having a tube passed down your throat. You don't have to come to hospital for it. And it's very effective in terms of identifying abnormal precancerous cells.
Oh, that's a very good sample. Are you okay?
Funded by donations to Cancer Research UK, the Cytosponge is now halfway through its national trial, and it's already producing results.
Well, we have found some cases of early cancer, and these patients have gone on and had treatment. And we've also found Barrett's esophagus in quite a number of patients as well, and they have had their endoscopies and are now on a screening regime as well.
Depending on results, they hope the sponge will be widely used within a couple of years. The quicker, cheaper way to spot people at risk of esophageal cancer. Richard Westcott, BBC Look East, Cambridge.
Well, Professor Rebecca Fitzgerald is from the MRC Cancer Unit at the University of Cambridge, and you brought the capsule for us this evening. This is fascinating. I'd love to see it.
I thought you'd like to see the size of it, actually. It's about the size of a multivitamin pill. So really small and convenient for the patient to swallow. Very, very simple is the whole idea compared to an endoscopy. And we've made it as simple as possible for the patient, but then coupled it with quite a sophisticated, accurate laboratory test so that we can really pick up the people at high risk of cancer of the esophagus.
So who could access it? Who could have that available to them?
So the people that we're targeting with this test are people with heartburn symptoms. So a nasty burning sensation in the chest, very common condition. People take tablets for heartburn, acid suppressant tablets. So those are the people we want to see, because there are lots of people out there that go and get these tablets all the time from their GP, from their pharmacy, who never get an endoscopy test. And they are the people at increased risk. And you couldn't endoscope all those people, but if you've got something this simple, then you could offer them this test in the GP surgery instead of an endoscopy.
And those you've already tested, you have found some interesting things already?
We have. So clinical trials, we can't know the statistics until the end of the trial, but I can tell you we've certainly picked up patients with Barrett's esophagus, which is the precancerous condition, and we've picked up some people, a small number of people with a very early cancer who've gone on and had treatment. So we won't know till the end of the trial, what the proportion, the actual numbers are of those that tested that we found and so on. but it's looking very promising. And the other thing I can tell you is that we measure what patients think about it. So we ask them to rate it on a scale between 0 being horrible and 10 being very acceptable, and our score at the moment is 8.5 out of 10. So people think this isn't bad.
Yeah.
It's a pretty simple thing to do.
And just finally, and you're coming up with loads of ideas like this. How common is it, and do you think catching cancer early actually is going to be a massive difference?
I think that's a really crucial thing for improving outcomes for people with cancer. So in Cambridge, as part of our Cancer Centre programme, we've got a major focus now on the early detection of cancer. We're working with physicists, chemists, engineers and hospital doctors to really understand what are the main cancers we should try and focus on to detect them more accurately early, and what kind of tests we could do, measuring things in urine, blood, breath, simple things, scalable things that would be much better alternatives than invasive tests.
Well, Professor, thank you very much indeed for coming in. It's absolutely fascinating,
Thank
and
you.
yes, really is something to look forward to. Thank you.
Thanks.